I know that you advised the White House and the Department of Health on infectious disease threats. In this particular case in Dallas, it seems the medical community didn't properly diagnose the patient, at least originally. What does that tell you about how prepared, or for that matter, how unprepared we are in terms of our ability to fight this disease here at home?
Well, the fact that someone was infected in Liberia and got on a plane without any symptoms and landed in the United States and then after several days developed symptoms is not surprising. Given the magnitude of the outbreak in West Africa, including Liberia, this is something that would be almost inevitable that someone would come here. It's unfortunate that the patient following the onset of symptoms wasn't immediately diagnosed when they went to the emergency room the first time. Now, obviously, the patient is in the hospital with the proper infection control and being taken care of and seriously ill. The critical issue now is doing the kind of contact tracing of people who came into contact with that individual and getting those people identified and observing them and monitoring them to make sure they don't get symptoms. And if they don't after a period of about 21 days, then we'll be okay. And if not, then you've got to isolate them if, in fact, they develop symptoms. We don't feel at all that this is going to lead to an outbreak because we do have the capability of doing the kind of contact tracing and isolation if it becomes necessary. So it's unfortunate that this happened, but we don't see this as a threat of an outbreak in this country.
You don't see it as a threat of an outbreak. I mean, we should remind people, Dr. Perlin, that this is a disease that's difficult to spread in terms of large numbers, and perhaps that should give people some comfort.
Indeed. This is a disease that requires close contact, spreading of bodily fluids, but the ability to control it, as Dr. Fauci said, really has to do with the contact tracing. And part of the reason that HCA supported the CDC Foundation with a $1 million gift was to help to implement some of the infection prevention infrastructure that we take for granted in the United States. That is, that the CDC Foundation identified the needs for really training lay people for contact tracing, providing basic protective equipment to prevent the spread of infection, as well as generators for field units, vehicles for transporting patients, and motorcycles to transport the people who would do the contact tracing that Dr. Fauci spoke of.
Lisa, how much money ultimately do we think this will cost to actually fight this? I mean, you saw the CDC numbers, potentially 1.4 million people being affected by early next year. Are we talking potentially $1 billion?
I think so, but I think it's important to bear in mind that the CDC did that scenario, and it wasn't really a prediction, it was a scenario planning before the United States made the decision to send 3,000 troops to the epicenter of the crisis and deal with it. That was a prediction that was made, or a scenario that was painted if there had been no major intervention. I think that now we're beginning to see a huge intervention by the United States. Some additional countries are beginning to pitch in, and so I don't think that it's at all probable that we're going to see 1.4 million cases of Ebola, but certainly the WHO has predicted that it will take perhaps $1 billion to fight this epidemic. And to get back to the larger question, Trish, I think it's important to remember that the reason that Ebola has gotten so out of control in the three countries where there is an epicenter of this epidemic is because they don't have the kind of infrastructure that we have in this country. And even Senegal and Nigeria, two of the countries to which Ebola has spread in this epidemic, even though they don't have nearly the infrastructure that we have managed apparently to contain the epidemic. So I don't think there's really any cause for a great scare in this country that it will spread.
Does, in some ways, Dr. Fauci, the news of a case in Dallas help focus the entire world and certainly the United States on the importance of putting the infrastructure in place on the continent of Africa to fight this?
Well, certainly that's true, but that's not going to happen over a short period of time. The dysfunction of the infrastructure there is something that has been there for a very long time. But you're correct. It does tell us we would not have to worry about the threat of a person coming to the United States with Ebola if we shut down completely the outbreak in West Africa and the West African countries. That's the best way to stop the exportation and then importation into this country of cases. You're absolutely right. the dysfunctional healthcare system is the reason why we have this outbreak to such a great magnitude in those West African countries. So on the one hand, the immediate thing to do is to put down and completely stop this outbreak in West Africa. But the long-range plan is to build an infrastructure there so that this does not happen again.